Good day, Miss Adi. I hope you're well aside from the discomfort that you're in. Your presented complete history, as well as intraoral examination, has revealed a large carious lesion or cavity on your forehead or your right lower wisdom tooth, which is most likely the cause of your pain and discomfort. However, I noticed that your wisdom tooth appears impacted, meaning that the tooth is not upright and or at the height of occlusion or level of the other teeth. Unfortunately, Miss Adi, you have irreversible pulpitis, and to rectify such, we usually root treat or extract the tooth. However, root treatments are not routinely done on wisdom teeth, so your tooth would have to be extracted. To assess the difficulty of removing an impacted tooth, we use different classification techniques, such as the angulation of the crown, Pell and Gregory class, Winter's lines, the relationship of the apices to the inferior dental canal, and root morphology. From my radiographic findings, your lower right wisdom tooth is horizontally impacted, meaning that the long axis of the tooth is perpendicular to adjacent teeth, or the tooth appears to be laying flat. This carries an intermediate difficulty with respect to extracting. It has a Pell and Gregory class of B2, B meaning that the height of the crown is between the occlusal plane and the alveolar bone crest, whilst 2 means that the crown is partially in the ramus of the mandible, and that's the arm of your lower jaw that ascends. Both the height of the crown of the tooth and the position of the crown in the ramus gives moderate difficulty for the extraction. According to Winter's lines, the white line is drawn at the occlusal surfaces of the erupted first and second molars. The amber is drawn along the crest of the interdental bone between the first and second molars, extending distally or backwards. And this indicates the margin of the alveolar bone surrounding the tooth. The red line is dropped perpendicular from the white line to the point of application of an elevator, but is measured from the amber line to the applicable point. And this measures the depth of your tooth, your wisdom tooth, in the mandible. If that red line is more than 5 millimeters in length, the extraction is considered sufficiently difficult. As the average width of a molar is approximately 10 millimeters, from this diagram, we should both be able to agree that the length of the red line from the amber line to the applicable point is more than 5 millimeters. As you can see on the radiograph, there are 2 thin radiopaque or white lines, which we call tram lines. And those lines pass near the roots of your tooth, which resembles a canal. That is the inferior dental canal, where the inferior dental nerve lies. The variation in appearance of these tram lines indicates a possible intimate relationship between the roots of your tooth and the inferior dental nerve. In the radiograph, your inferior dental canal appears to narrow at the apex or the root tip. A CBCT or 3D visual of the tooth should be taken to confirm that the tooth is not communicating with your inferior dental canal. If it is, then that draws a major challenge to the extraction procedure. But if it is not, the challenge is lesser and you would be at a lesser risk of paralysis or nerve damage. Lastly, your root morphology or shape and number of roots on the tooth are another determinant of the difficulty for an extraction. Roots that exhibit flexion, dilaceration, concrescence, fusion, accessory roots, hypocementosis, or enamel curls add major difficulty to an extraction, as the path of extraction is not direct. Luckily, the roots of your tooth appear within normal limits and do not add a challenge to the procedure. I know you may not want to extract your tooth, however, I also would like to bring to your attention that the impacted tooth is resorbing the adjacent tooth. Ideally, you should remove your impacted tooth, seeing that has a large curious lesion, because if you leave the tooth in, not only would you continue getting the pain from your irreversible pulpitis, but you also put yourself at risk of losing not one but two teeth. I hope this is clear enough for you, and if you have any questions, please feel free to ask me. Thank you.